Welcome to Healthcare Blind Spots. I'm Vivian Kofsinja-Birchall, your host, and my special guest on this episode is Mr. Barnabas Nkore. I've previously had him here talking about his work with Vantage Care, but today we're going to dive deep into the work that he's doing both here but mostly in Uganda. Mr. Barnabas, welcome.
Thank you, Vivian, again for hosting me. I know, and your talk show, Healthcare Blind Spots. Oh my God, it's taking the world, over the world. I have watched it like 7 views in one day. It's an amazing show, and what an impact you are making to the world. And I think the real goal of such programs is to benefit and enrich the entire world. So good job, thank you, keep pushing. I can't wait to see you get 1,000 views in one day.
Yeah. Right. It's feedback from people like you who keep us going. I work with an incredible team here at ActonTV, Mark, Ducey, behind the scenes. But yes, it's always great to bring these stories to life, stories of healthcare, the disparities that exist, but not just focus on the disparities, the solutions that people are creating. And you're one of the very admirable people for the impact that you're having on your home country, Uganda. Previously, we talked about how you translated all the experience that you're getting here in the United States as a nurse into the workforce in Uganda to try to really meet a niche or meet an area of need with a solution through Vantage Care. So perhaps for the benefit of those who missed the first interview, just tell us very briefly, again, who you are and the background of that company, and then we'll take it from there.
Thank you again. Yes, my name's Barnabas Nkore, born and raised in Uganda, but I have lived half of my life in the United States. So, though Ugandan born, I immigrated here in 2000, and like any other immigrant, you have dreams to achieve. Professionalism, supporting family, and making a difference. So the career I have been involved in, geriatrics, taking care of the old people, has been a very rewarding journey for me. And it always came back to me, what can I give back? Given the expertise, 25 years is, you learn a lot of things. And there are so many blind spots when you go to Uganda, in terms of health, the spots that, the gaps that need to be filled are enormous. There's so many opportunities in healthcare. So it came to me, I found a blind spot in the care for the old people when my mother got sick. And that year she had been hospitalized 3 to 4 times, but then the last time she had septic shock. She went to the hospital unconscious, and when I went to see her, like we usually go and I see diaspora people say, yeah, Uganda's health system is bad, they don't care, but for me I saw an opportunity in that. And I would like most of us to learn from the negative, twist it into the positive. So I thought, look, this is an 80-year-old woman who went to the hospital unconscious for poor management of her personal care, urinary tract infection. She had also underlying conditions, blood pressure, diabetes, arthritis. She couldn't see, incontinence care. So, but after that hospitalization, that woman was frail. And when you see someone frail, you understand, you see them, it tells. And these are things that, the conditions that could easily be managed at home. So putting someone at home, taking care of my mother, she spent 4 years without any hospitalization. Those are the conditions that were perfectly managed at home. Poor woman, she passed on last year in April, but we enjoyed 4 years of her presence. People will say, will do anything to keep their loved ones alive for a day. But this woman, these services gave life to my mother for 4 years. So we had the privilege to share so much with her. And so when I looked back at the country, you know, Uganda is growing old. We have so many people, 80 years, 100 years, and projections are showing 6.5 million, 60 plus years in the next 20 years. Those people come with underlying conditions. And so I started a program to manage healthcare conditions of old people. But then the other blind spot was we have people who have difficulty with people with disabilities, people who have developmental challenges. We have mothers and babies who need care, short rehabilitation care. So I just started. I mean, we are today, we are not where we are supposed to be, but we are not where we started from.
Absolutely. And we're going to dive into that because that requires resilience, it requires resources, it requires focus and commitment. But, you know, just to piggyback off what some of the statistics that you pointed out, when you say the world is aging and Uganda is aging, can you describe what that impact is on the healthcare system, especially regarding geriatric care, and how, you know, what you would envision, you know, a solution like what Vantage Care is giving to Uganda could be if scaled up?
In fact, it's so the issue of older persons, the geriatrics, is global. And Africa, as a continent, is expected to have the highest number of old people, 65 plus, in the forthcoming years. By 2050, we shall have 225 million old people. And when you look back at a developing continent, growing old, we do not have structures, we don't have infrastructure, we do not have policies, guidelines to help this population. But if I roll back, like, we are going to have 2 billion old people worldwide. I don't know if Africa is going to have 250 million people not paying taxes, at home, sick, and our culture is pay out of pocket. I mean, it's not going to be easy for a developing country like Uganda, which is looking at 12 million old people retired, looking for support. And we do not have systems, infrastructure, policies, and guidelines to support this health sector. So that's where Vantage Care comes in. The blessing that we have, I mean, is owning a business in the United States gives us the backbone of knowing what to do. I mean, there's nothing that we do not have regarding geriatric care, the experience and the expertise that I have for the last 25 years. I mean, that's where I flourish, and it doesn't only end at providing care for old people, it also comes with end-of-life support and care, and that's also a different whole ball game. So that's where we are coming from with Vantage Care.
And then in terms of, again, you've talked about systems, policies, that's a lot. But, you know, it's like this whole big pie of, you know, what needs to be done. But in terms of, say, Vantage Care, I know that you have been training a workforce to start, but among other things that you're doing. Let's first maybe dive into tapping into the population, the Ugandan population, which is a young population, as a way of managing the elder population. What is that vision like? What does it look like to you? And how would you want to tap into that younger population to support the older ones? And part of the background of this is the trends, the changes in the way we look at older people, you know, as a society. How is that changing, and why should we make sure that we position the younger people in a way that they respect the elderly?
So, thank you very much. A very important question. So with Vantage Care, getting into the country and starting an operation like this wasn't easy. It's still not easy. However, I will tell you that we are proud to be providing professional home care services. That means we are bringing quality, dignified care to people. You know, with aging, one of the major issues for the aging is increased disability. And that means we provide activities of daily living and instrumental activities of daily living, ADLs, personal care, grooming, feeding, transfer, toileting, reposition, ambulating, keeping company, fixing meals, light housekeeping, accompanying these people to the doctor's offices, to churches, to graduations, to weddings. All these are the things that we do. But imparting the knowledge of helping someone to support someone in their home, we are imparting values. It's bringing empathy, kindness, compassion into the new generation of Ugandans. So we are providing, we are killing one bird with two stones. Killing two stones with one stone. I'm sorry.
Two birds with one stone.
True, thank you. So our home health caregivers are predominantly the youth. And our entry point is senior 4 and above. And we are the only accredited home care company by the Ministry of Education. We have a curriculum with modules that provide knowledge and skills to the young ones. We've been blessed with so many school leavers who have finished S6, S4, and a few graduates. It's amazing how they get to this program, including nurses who come. They say, yeah, we have gone through a nursing school, but we've never studied. This is actually the basics of nursing. So we provide employment to the youth. Vantage Care has trained over 250 caregivers since 2020. We are making a significant impact in the community by providing professionalism, professional care, dignified care to the clients that we provide countrywide. So, two things: providing employment, job opportunities, and giving back to the nation, to the mothers and fathers of our country. It's amazing how interested the people that we take care of, how they get attached to the services that we provide. We have no regrets. We have only smiles on us because we are bringing quality to the country. I told you about the greatest achievement was to have the Ministry of Education accredit this program. It's similar to the one we do in the United States, by the way. The only difference is that we train longer.
Okay.
Yeah, we are more detailed because it's new to the continent, to the country, and so we want to do the right thing. We can't do it so quickly and then we go in the community and do things that are not supposed to be done. So we take time. We take 4 weeks in the class, teach the art of caregiving, and then another 4 weeks in a hospital setup where they do all these practicals on the floors of the hospitals. That has been phenomenal, and we've been accredited. We issue certificates which are offered by the government. These are credible certificates that have given employment to people abroad. I know 2 employees who went to Canada. They entered the workforce without redoing this course. One went to Indonesia. We have so many in the Middle East, Saudi Arabia. We have one in Arizona, the one that I know from the United States, came and started working in Arizona. But locally, anyone with our certificate works in any hospital, any facility, healthcare facility, they get jobs because our work is considered very essential. So that's big. And I want to appreciate the Ministry of Education, particularly that time DIT. Today they call them UVTAP. They have changed the name. But to recognize that this is needed in the country, we are pioneering healthcare services in the country, if not in the region. And we're very proud of that. The other achievement is that we have a relationship with the Ministry of Health.
I was just about to ask that because this is healthcare, and so far you had mentioned only education. So can you tell us more about that with the Ministry of Health?
Yes, so actually the journey with the Ministry of Health is also interesting. And when you see me talk to you about achieving a relationship with the Ministry of Health and MOU, that's very serious. And what did they want us to do? We signed an MOU last year in, I think, in April. And this was because they saw what we were doing as very significant. And the question was, is this education or is this health? So there was an agreement, interministerial agreement. They said, yeah, we can work together. And now Minister of Gender says, here we are at a policy level, what can you support us with? But Ministry of Health recognizes what we do. They recognize that people we care for do not come to the hospital often. They recognize that we can actually manage a generation of so many people in the community. So the challenge is on them. And I'm glad they are writing the strategy for older adults as a result of our collaboration.
That's exciting.
It's very exciting. I have been able to look through it. We are adding so much. We are contributors in that. And we can't wait to see it come out to be the national guide for caregivers in the community. So it is opening us more opportunities. They hoped to give us an opportunity to train all Ugandan government healthcare givers, which was exciting. But you know, the government budget and the money, they say, yeah, we are signing this, but you may be considered in the next budget. And they depend a lot on their partners. And so, but you know what happened recently, the money reduced. But we are looking forward to the ministry's recall, call us to go and support. I mean, when things happen like they have happened, I mean, it tells them that, yeah, we need to do things on our own.
Right.
In our country, budget for services that benefit the country. So 2 major achievements have been offered to us. We are very happy. We one step at a time. Vantage Care is seeing itself growing slowly, but making an impact to the nation.
Absolutely. And again, you are doing incredible work. It's very admirable for somebody in the diaspora, again, transferring those skills back home, which brings me to the next question. Many people here, many healthcare workers, Ugandan origin, might wonder what it takes really to give back, because oftentimes many are afraid of starting something back home, especially if they have also lives here. Maybe just to focus on what is the value of giving it a shot to say, no, I'm going to give back to Uganda. And also the other, you know, just to piggyback off what you just said in terms of the trainings, how do you stand out in terms of healthcare compensation? Because I had previous conversations with nurses in Uganda, and one of their challenges was underpay. So how do you navigate those challenges that nurses locally face?
Thank you. Beginning a business in Africa, in Uganda, particularly my country, is not easy. However, I don't want to say that the country is open to people who are bringing skill, expertise, new ideas, innovations. It takes a long time, and given where I was born, I don't wait. So the idea came. I saw my mother's condition, and I felt the desire and the resilience and the energy was like, there's need, there's a blind spot here, and it's a huge opportunity for the future, forever. I mean, people no longer die young. It's not going to stop. However, when you look at the increasing non-communicable diseases that are on the rise, say in our country, the diseases Caucasian people get when they're 60, 70, we're getting them 5 to 10 years earlier. And so it's not a good thing, but these people are going to need help. So I looked at demographics. At that time, it was like 800 old people in the country. And to my surprise, in my visits to different hospitals, you find people at 50 years with a stroke, 45 years with a stroke. They can't take care of themselves. And this is increasing. Cardiovascular diseases are taking over. Diabetes among the young adults.
We're eating junk food, enjoying it like a lifestyle
and it's a lifestyle, and it's people think if I have dinner at Cafe Java's or no,
we're not going to say any restaurants. We're not going to throw any restaurants down the.
We have so many lifestyle.
Yeah,
it's a result of all this. So I went around to see Ministry of Health, how do we begin providing services like this? Because one of the gaps or blind spot in our healthcare system is that they didn't have in their structure home care services. Because we never grew old. People, Uganda never grew old. It's amazing. Never in the life of our country have we ever experienced the number of old people like we have today. We have such a privilege of enjoying the benefits of today's better lifestyle, eating well, medications that used to that were never available. I mean, an infection used to kill someone in 2 days. Today, infections rarely kill people. And vaccinations think anyone who is vaccinated is guaranteed an extra 30 years of life. So, we have education, sensitization, mosquito nets themselves, mosquitoes. So, things that used to kill Ugandans no longer kill them. So, I just had to start. I got permission from the Ministry of Health. They did not think, I did not have that enormous support to start. Said, you go start, but do not start in government hospitals. Find a private hospital to work with, and maybe we will talk to you after that. That was the beginning of Vantage Care. We approached Nakasero, and what they wanted was, we want to know whether the government recognizes you. But we had that official approval to train and practice that saved us. So we didn't have any facilities. My neighbor offered me a veranda. That's where we started our training. We eventually bought a tent, and we trained in a tent for about 1 year. Then eventually we started to train in a rented room around in Tinda. But today the journey is amazing. The company now is providing training in owner-owned facility, and we're actually putting up. We are putting up classes, skill rooms, and there's a possibility of a wellness center. We are also putting rooms where we can take care of people, because we are receiving so many phone calls of family that are looking for accommodation for their loved ones. So that's an opportunity. And you see the diaspora, that's where investment comes in. We know better. So, and then dormitories. The only thing is that we are on a very small piece of land, and the space we can only expand up. So, but we are proud to be in our own facility, expanding. It has been an interesting journey.
Well, we look forward as ActonTV Healthcare Blind Spots to come and tour.
Absolutely, it's yeah. I saw a picture today. My kids are at the facility. They are in Uganda, and they were saying, "This is what you have been doing. Good job." So, the training that we offer for 2 months issues certification from the government, meaning they get certificates from the government. Our entry-level salary is way much better than government certificate nurses. I don't know whether I say it, but if anyone in the diaspora has someone who's looking for a job, if you have a child, if you have a friend who needs training and is on training and the entry level, it's a good salary. We do very well. We don't have complaints of pay. We pay them, and they do much less work. They are comfortable with the families that they take care of. The salary is very conducive and attractive. So the other benefits I have had when I go, the stories I have had is that, this job gave me an opportunity to fly out of the country, because they take these patients for medical tourism in India, in Turkey, in other places. Say, yeah, how else would I have gone on a plane? The other day someone was flown in an helicopter up country with a patient. How it's amazing for them. Another one said, there's this, I can't say it in English. They said, omanyi nafuna nenkola ku muzungu because of akasomo kano. They say it's something interesting for them.
An opportunity to work with someone from another country.
From another country,
Yeah.
yes. So you find that they are very proud of what they have benefited from the course itself. We have seen some of our patients are discharged independent because of what we do. The diaspora people that I want to thank so much for hiring our services, because they understand the impact and the benefits of having professional services in their homes. They have always said thank you for providing these services. Our parents, our loved ones are flourishing. I've seen videos of their mothers and dancing, walking, exercising. It's an amazing journey. I'm very proud of the program. And it's something that I want to see expand to other areas to all corners of the country and beyond the country.
Well, I am proud of you for all the work that you've put in, and for the impact really on the country, and even impact to us diaspora who are watching you from a distance. Some of us might not say much, but we're motivated by what you do. But I guess, is there anything that we haven't talked about, especially about geriatric health now, to get more into the health issue as opposed to the management issue? When it comes to, so before, people have had the stigma of not giving their families over to somebody else, an outsider, to take care of them. That's a cultural thing. So have you seen a shift in that? And when you're encountered with families that are, they're skeptical about letting a stranger into their home, how do you navigate that?
Absolutely, and reality is getting on the ground. So knowing that our culture has been family taking care of their loved ones in the home setting. So we are bringing that. We are family members taking care of their loved ones where they are not. It's such a benefit to them because they have, the clients that we take care of feel comfortable in their home environment. And there's nothing that can beat that. to be home with care that you deserve. I mean, they have lived in these homes forever, and to separate them from their homes, this it gives them, deteriorates them. So, however, there are those struggling families who have loved ones in the community, and they know they have poor care, they are isolated, they are abandoned, they can't see them quite often. And even when they see them, they don't have the skill set to manage what there's the best way to care for them. So we are filling that gap of bringing care into their homes. But we are also overwhelmed by the number of phone calls of people who want to bring their parents under our care in a facility.
Right.
So,
and how is that, how does it differ from what you've seen in the United States? Because you work here, but also you're seeing that you're providing a service back home.
Yeah, here, and by the way, Vantage Care that I own in Boston is the one that gave birth to Vantage Care in Uganda. The difference is that we still provide home care services. Families don't have to be there in order for us to get hired. I get a phone call from healthcare proxy, a son, caregiver in California. My mother in Newton had a fall, is being discharged from the hospital. We need you to go in. So they send us there. The level of trust here, integrity issues, we go in and take care of their loved ones, manage all the care, including managing their medications. And that's one. But then there are also those families that have opted for long-term care facilities. And that's also an eye-opener for African countries, including Uganda. There is that need that families who can no longer take care of their loved ones in the home, there's that need of give them an option. I mean, this is a setup that makes life much better. They meet new friends. They are served 3 meals a day. They have activities that engages them. They are looking forward to several other activities, tours, music, games, puzzles, concerts, movies, old music playing. All these engage them. And then they are looking forward to an activity that gives them life.
Right.
So looking at a model like that in Uganda, I think it would work. And honestly, the diaspora, I hope conventions like UNA could say, let's consolidate a fund and put a state-of-art, one of its kind, an assisted living, a retirement home, where services like those are offered. I mean, that can be a pilot and can give birth to many other assisted livings in different regions.
Right. And which, before I forget, actually, when you're talking about the diaspora, and this is going to be one of the last questions I ask, and how, the potential to mobilize and put up infrastructure like that. One of the challenges with we have seen with our people back home is they cannot afford care, and so the diaspora sends money a lot. So and we are having all these conversations about how to finance healthcare. So when you think about that, what easily comes to your mind? How can we improve financing for services like geriatric health through diaspora remittances? Because and we could come back for that conversation, but it just caught my, I just thought of it as you were talking about what diaspora can do in terms of creating a model that kind of brings income but also helps.
Yeah, so, and I'll go back to a group like UNA, like
right.
We have also UBCA, we have International Community of Banyakigezi, the Batoro, the Basoga, almost Banyankore, Kweterana, all these groups. I mean, it's that time. Because, look, our government is open to ideas like this, talent, skills, innovations, and I haven't applied this. They reach the point of they can give land and support. The only thing is that I've had a lot of fraud. People go and they say we can do A, B, C, D. Some people have sold the land. The government has given them that That's so they want to
That's
see
fraudulent,
you.
yeah.
They want to see you reach somewhere before they support you. But I think it's a good gesture that they want to support brain gain. You know, there's brain drain, but now bringing Vantage Care is brain gain. I mean, the skills, the curriculum, the services, the the values of care. I mean, it's that the diaspora can come back together with good leadership. We can see changes, and not only in healthcare. There are so many other opportunities. Everything I have seen, like we criticize our country about, is an opportunity. You land at the airport, you complain of poor services. That's an opportunity. You go transport, taxis, you go to schools, you go to places that we complain about. Those are opportunities. But I mean, who is going to turn it around?
Right.
It's us. If we see it as a negative thing, there's an opportunity in it. The other opportunities in this emerging demographic population, now Vantage Care is providing home care services. It's providing employment. We just talked about retirement homes, the assisted living facilities, the rehabilitation centers. We have so many nurses that have graduated in psych. We have PhD nurses in I know so many in Boston itself. We have medical doctors here. We have people in business, in banks. I mean, you go to Centenary Bank and see the crowds that are there. If someone is in banking, for me, when I go into Centenary Bank, I always pull out the money and say, look, show me any of your employers smiling. They are overwhelmed. I mean, this is a project that was, I guess, underestimated. They don't know where to put customers. Same way, the attitude in hospitals and the banks and schools, they are all opportunities that the diaspora can go and take and improve. So, but the opportunities I see in this small section of geriatrics, bringing wellness centers to place, pharmacies for geriatric medicine, training, we don't have a single pharmacy school training for geriatrics. I mean, the gaps in education system is that from the training of certificate nurses to a PhD up to the university, we do not have a module specialized in geriatrics. So in my talks, I encourage students. I speak to students, I speak to groups, I speak to churches. This is a huge opportunity. You ask people, ask students, what do you want to become? I want to do IT. I want to become a lawyer. I mean, this is a huge global need of geriatric nurses, geriatric physical therapists, occupational therapists, nurses, doctors. It's so much that, and then look, suppliers of all people's equipment, basic medical equipment. I mean, the food industry needs to think. People who are growing old lose teeth. How are they going to chew regular food? I mean, that's a different...
Inyama.
Yeah. Meat, yeah. Clothing, the anti-aging industry is also on the rise. I mean, they are getting old, but they don't want to look old. Although
I have a problem with that, and I think I've talked about it because there is a sentiment it gives when somebody says anti-aging. It's as if we are demonizing aging, and instead of looking at it beautifully as, oh, we've been privileged to live this long. So I'm not saying it's, everybody, of course, has a choice in this, but, using the word anti-aging.
So that's how they call them. And you couldn't have put it better than that, Vivian. There's beauty, there's knowledge, there's value, there's enjoyment in this cluster. You just have to enjoy the old age. And you know what? You and I are not going to skip it. However,
don't remind me.
No, it's something I'm looking forward to, although not soon. But look, the media has made the anti-aging industry flourish by putting negative connotations on age. Like, if you don't wear a wig, then if you wear your white hair, or if you don't wear in certain style, if you don't look in a certain way, then old people have been put in a corner, like, yeah, you are a dependent, you're a burden, you are no longer productive, you are ugly, there's so much connotation. And the media has flourished using that to promote their product, to promote anti-aging products. So, but that's also an opportunity for people who don't want to look old, then go buy black hair, go buy clothing. I mean, there's so much
exercise.
Exercise, gyms, yeah. At Vantage Care, we thought old people need a social place where they can socialize. So we are putting up one of the sections of our construction is like a gym for old people, 60 and above. Aging people. Yeah, where they can walk on a treadmill, where they can have their old music played, where they can be served a meal, where they can play cards, where they can other games, where they can do exercises that fit their age. So I'm looking forward to that kind of new association, meeting place for people who share the same quality of life and values. So I hope these people will be able to come and enjoy weekend togetherness. The issue of anti-aging is they call it ageism.
Yes.
And the generation coming up really needs to be sensitized that there's a lot of value in an aging population. The other opportunities that we have, I mean, palliative, hospice, end of life, chaplains, social workers. I mean, chaplains are a big component when it comes to end of life support.
Right.
So I hope, we have all this. I mean, I am also associated with a Medicare accredited company, Age Life. They are our biggest partner. We have all these support documents. We have all these support policy documentation. So we only need to come together and we'll be able to share what we have.
Now, again, we can go on and on because there's a lot to talk about, and I'll probably bring you back to talk about even a wider vision for geriatric care and home care in Africa at the continent, because earlier we talked about some statistics, and there is still the need, not just in Uganda but Africa. But for now, I think just in the interest of keeping this interview very, manageable in terms of time, is there anything that we haven't talked about that you would like to tell our viewers, maybe one last word for them?
It's not going to be one word, I'll warn you.
Not one word, but
I want to appreciate my staff. Our home caregivers are the real reason we're in business, and our clients who give us work to do, they're the ones that make meaning for our program. Our work is in the home, but we're making an impact on the nation. I also want to thank our partners. Nakasero Hospital stood with us up to now for practical skill practice. They have not said, they have never closed their doors. And recently, I want to honor the neurosurgeons of Mbara Referral Hospital, also who saw our program and said, no, you can't only limit yourselves to the geriatric section. We have people we operate on that can't manage their care after surgery. So they have signed an MOU with us, and we are looking forward to working with them. We have a physical therapy group that we have signed an MOU with them. Mulago Hospital also has been, every time they know I'm in Kampala, they want me to speak to their nurses. They have given us opportunities to work with them. There are 2 local nursing schools in my diocese of Kabale, Mutorere and Nyachibari. They are very lovely. There are 2 nursing schools that have supported us by sending their students to Vantage Care so they can bring this knowledge back into their schools. The other people have of interest. I mean, the list goes on and on and on, but I also can't wait to sign an MOU with Mulago National Referral Hospital. I mean, the draft is at the desk of the Solicitor General. I hope to see that come out soon. So, like I said, we are not where we want to be, but we are not where we started from. And, you know, the incubation of this program to see it get us to where we are now has been a contribution of so many people that I can't thank enough. So I want you to know that I appreciate you, and I also want to appreciate the diaspora who have given us jobs, who understand the impact of what we do here, giving care to the people in the US, and those who understand that it means a lot for their loved ones. Please don't hesitate to reach us, and we will be able to take care of your loved ones. We will also provide employment to the people, to your brothers and sisters who need the employment. I mean, it's getting to a point where almost every homestead has an old person that needs help.
Absolutely.
Yeah.
No, thank you again for being a guest on Healthcare Blind Spots. It's always an honor to have you here. And
it has been a pleasure being back here. I can't wait to come back and talk about the global geriatric need of especially African needs, because it should not be the same discussion between ministries of health, ministries of finance, ministries of education, ministries of gender. It's time to come together and start this conversation.
absolutely. And to our viewers, I hope you have learned about geriatric health, the dynamics of it, and what a diaspora can potentially do for their home country, and what Barnabas Nkore is specifically doing in Uganda with Vantage Care. But for now, thank you for watching. Till next time.